We are doing this for the good of the patient. There's the need to properly train laboratory personnel so that they will come out with accurate results. There's also the need for continuing education of laboratory personnel, licensure, certification of the personnel, so that they are up to date with information and their competencies are well grounded. Good morning, you are welcome.
Thank you.
Please may I know your name?
Alma Semenya.
Okay. The doctor has referred you to the laboratory for us to collect your blood sample and to find out whether you've got malaria parasite in your blood or not.
Okay.
We're going to prick your middle finger to collect the blood sample from you and then to be able to carry out the investigations that we need to do. So that's exactly what I'm going to do. First of all, let me get the slide. I'm going to label the slide with the patient's name, the date, and time of collection of the sample. Okay. This is called an alcohol swab.
Okay.
It contains what we call 70% ethyl alcohol. It is used to clean the finger that I'm going to prick, so that if there are any bacteria on that particular finger, we'll be able to clean it so that it doesn't contaminate the blood that we are going to collect. Are you okay with that?
I'm okay with that.
Okay. I'll clean your middle finger. I'm cleaning it to make sure where I will prick, it's a little wet. I'll wait for it to dry before I prick with the lancet.
Yep.
So this is called a lancet.
Mm-hmm.
It's very sharp. I'm going to prick you so that I'll be able to collect the blood sample from you. Please make sure to dispose of the lancet in a biosafety box. I'll clean the first blood off with the tissue, and then I squeeze it. So I'm collecting the blood in here. I'm placing a drop of the blood here for the thin film, and then 3 drops of the blood for the thick film. I'm using the glass slide as a spreader to prepare the thin film. At an angle of 45 degrees, you prepare the thin film. And then you use the edge of the same slide to make the thick film. Amma, thank you very much for your cooperation in the sample collection. We are going to process your blood sample that we've collected to find out whether you've got the malaria parasite in your blood or not. And then come back in 1 hour's time today, in an hour's time.
Okay.
By that time, we'll have finished processing the sample, and we'll give you your result to take back to the doctor for further action.
Okay.
Thank you.
Thank you. Bye.
We are going to prepare working gym sustain. You will take 10 milliliters of the stock gym sustain and then you add 90 milliliters of buffered distilled water to make a total volume of 100 milliliters. This is a 50 ml serological pipette, so I'll pipette 50 initially and then add 40 ml. This comes to a 1 in 10 dilution of the stock Gimsa stain. We now have the working Gimsa stain, which I am going to pour into the coupling jar that will be using to stain the thick and thin blood film. I am going to fix the thin blood films in methanol for 4 to 5 seconds. Fixing the second slide also for 4 to 5 seconds. I am now going to the hemoglobinization of the thick blood film, that is immersing it in water to dehemoglobinize the red cells. I will now immerse it in the 1 in 10 working Gimsa stain and we'll stain it for 20 minutes. At the end of the 20 minutes staining period in the working Gimsa stain, by means of a forceps, remove the stain slide and transfer it into a coupling jar containing water for rinsing the slide. Rinse it for 30 seconds and then remove it from the rinsing water and then send it to the drying rack for it to air dry. This is the binocular microscope. It is a light microscope for examining the blood films to detect malaria parasites in the film. It has a lens system, the head, which is usually inclined. We have the body, we have the stage, the diaphragm, and then the lens system. In order to be able to see the parasite very well, you need to clean the lens system so that you'll be able to see the parasite well. After cleaning the lens system, you get your slide, you place a drop of oil emulsion on the thick film as well as the thin film. And then you place it on the stage, put the oil emulsion lens in place, and then focus initially where the oil touches the ×100 objectives. From there, you start looking out for the malaria parasites. Malaria microscopy is being a method that has been used from time immemorial, and it will continue to be the mainstay for malaria microscopy in the sense that you'll be able to detect the parasites, the parasite that causes malaria, that's the Plasmodium species. You'll be able to detect it, and you'll be able to identify all the different stages. It will allow you to also identify the different species of the Plasmodium which causes malaria in humans. Microscopy is quite inexpensive, cost-effective, and economical, and it's also sensitive. It can be used to monitor treatment failures. It can be used as a follow-up in whatever investigation that is being done. It's used also in epidemiological studies for certain interventions that want to be in place. You can also use it to monitor drug resistance to anti-malaria drugs. So malaria microscopy is indispensable.